do it. You do it. She'll go and do it. She'll go talk to anybody. She'll introduce herself before I will at any time. So I just want to introduce you to her. She's going to bring out the speaker. And also we're going to have fun. I'm going to hold up a sign that says clap. I want you guys to clap. When I hold up this sign, a lot of you remember it from the first time. I hold up this sign and say clap. You clap. Even if you don't want to, just clap. Okay? Okay? So now, no further introduction, here's Erin.
Thank you, John. Good morning, everybody. Welcome to the Southern Women's Network Talk Show. Just for the record, yeah, I am the oldest. However, she does not do everything I tell her to do.
Good girl.
It's so good to see you guys this morning. Welcome to the show. Today we've got a fabulous doctor with us. Those of you who were here a couple weeks ago when we do our first show of the month, we talked a little bit about what we're going to talk about today, hormones, and how they affect us, men and women. As you can see, we have some men in the audience today. I also have some questions from men for the doctor. So I want everybody to relax. We're going to have fun like we always do. I'm going to relax. He is my doctor, so I have a relationship with him. But without further ado, I'm going to introduce to some of you, and some of you may already know him, Dr. Samuel Tyuluman. Hi, we call him Dr. T. Thank you for coming.
You bet. Well, I was pleased to hear that no one is allowed in here that's under the age of 50. Right. So this is my group. I'm 62, and I've probably dealt with keeping people healthy for a long time. Started out in obstetrics about 30 years ago, and that's the most important time for me because I was keeping people healthy through their pregnancy. I was keeping people healthy through their pregnancy, so I got to learn about nutrition and all that stuff, and I carried it through. I started taking care of people after they had their babies, and noticed the hormone imbalances and the hot flashes and started dealing with that. So started taking care of women with that. And about 30 years ago, I started giving hormones to women to keep track of hot flashes. And that's gone back and forth. Oh, it causes cancer. No, it doesn't. Yes, it does. No, it doesn't. So all through the years, we've kind of focused on that kind of thing. And people, hot flashes can last a long time. And sometimes some say it may up to 15 years. So all this fits together in what you probably want to look at as wellness, just a wellness kind of thing. Hormones play a big role in that. But you want to pay attention to the affluence you have. Okay, hold it a little closer. You want to pay attention to the impact of affluence, eating too much, and then aging comes into play. As far as hormones go, women have a lot of issues with hot flashes, sexual dysfunction, and incontinence. Men have issues with erectile dysfunction and libido, both for men and women. And so over the years, I've been treating people for all those conditions, and we come up with a plan, Ari and Reggie, and we kind of sit down and talk with you. Men and women are very similar as far as how they respond to testosterone. Testosterone is a very important hormone for women and men both. It's the dominant hormone for women. Estrogen will keep your hot flashes going, but the distal part of the vagina is very similar to the distal or the proximal part, or the closer part of men. So with testosterone, you can get a large impact on erectile dysfunction and libido. And for women, you get a large impact on sexual function as far as orgasm and sexual satisfaction. Hot flashes have a lot to do with estrogen balance. Estrogen balance, when your body wants estrogen, and it squeezes it from any organ it can find, okay? Hot flash is the brain saying, I need some more estrogen, and it'll squeeze it from your ovary at first, and if the ovary stops giving it to you, it's going to squeeze it from your fat storage, okay? And that's why it lasts so long, because you get a little bit from your fat storage, you get a lot from your ovary, when your ovary quits, and you get the hot flashes, and you can't sleep. You can't get to bed, and the hot flashes keep you awake. They don't let you get into a good REM, deepy, kind of chewy, good, dreamy sleep. Okay? That's what you want to shoot for there. And a good sleep pattern is very important to keep you healthy. It's an important factor in wellness, okay? And hormones are available for everybody. I have patients in their mid-80s that do it. Keeps your bones healthy, keeps you sleeping well, keeps your sexual function going. And so all those things are important for people, okay? So let me do this. Let me ask you.
Okay, go. I was gonna have you take it.
Oh, okay.
I want to ask you a question.
I was just going to say, hey, if you have any questions, let me start, and go from there.
Great. Have a seat, Dr. Tyuluman. I'm not used to calling him that. I'm used to calling him Dr. T. Please feel free to do so.
Yeah, sure.
Because he's really cool like that. Dr. T was explaining a lot about estrogen, testosterone, and we're going to talk a little bit more about that. He was talking about sleep. As we talked about before, I told you guys that Dr. T gives me hormone shots. I have a hormone shot once a month with B12 too, because I need a little energy. I know some of you do too. So I have a hormone shot and I have a B12 shot once a month. Well, I missed my shot. For those of you who weren't here earlier in the month, I missed my shot. I started having hot flashes, mood swings, and I told you when I cough and when I laugh, I will do what? I didn't hear you. Urinate. You are so proper. Urinate. Yes, I would pee. So, I went to Dr. T and I told him what was going on. He explained to me about the sphincter,
Yes.
the sphincter muscle, and how, I said it wrong.
No, you're fine.
That muscle.
That muscle.
That muscle. And without the hormone and is it the estrogen?
Estrogen?
Without the estrogen, it'll cause that leakage. So if you have your hormones balanced, and that's what Dr. T does, balances our hormones so that we are able to control that leakage. You don't have to have that. A lot of people suffer from it, and we don't want to say anything about it because we're shy, we're embarrassed. Don't be embarrassed. It's a normal thing in life. When we get a certain age, we're mature, and we develop, and our minds change, and our bodies change. So it's a natural function. So don't be ashamed. Don't be ashamed to come to your doctor. Many of you men don't have a hormonal doctor. That's where I see a problem. Because men are afraid to talk. You guys are afraid to ask questions. You're afraid to talk. Well, Dr. T is very easy to talk to. If you have a problem with erectile dysfunction or with, how do you say, making an erection stay?
Just erectile dysfunction is part of that, or sustaining an erection.
Sustaining an erection. Please. I have a problem sustaining an erection. And women, I saw that, right?
Sex is a hard thing to talk about. Sex is a very hard thing to talk about, man. But it's a very important part of your life.
Absolutely.
Just companionship and sexual synchrony with your partner and all that stuff is really important. And people don't often address it, and they're shy to talk about it. But it's part of everyone's life. I have sexually active 88-year-old women in my life. And they endured all the backs and forths about hormones and all that stuff. But they have companions. Their husbands are the same. And it's just a little bit here and there that'll keep that going for you and make life a whole lot more pleasant and fun. So
we're going to get to question and answers in just a moment.
Go ahead.
He said he was talking about 88-year-olds who have sex. And I said to I've told you guys before, until I die. Until I die. I'm not ashamed of it. I probably used to be ashamed of it, but I'm not anymore because sex is a part of life. And if you go to see Dr. T is going to explain to you about how sex keeps you healthier. Sex gives you a balance. You need that. We all need that. I've heard several people say, oh, I'm done with that. And I've heard about the box. I heard about the bedroom drawer. I've heard about all of that. You guys know what I'm talking about. Why y'all looking so bewildered? You guys know exactly what I'm talking about. We talked about lubrication last time. And Dr. T is going to tell you a little bit more about that. I want to ask you a question because some men are shy and some men didn't want to be here today, but they wanted me to ask some questions. One of the first questions that I was asked to ask you was, if you have high blood pressure, diabetes, or any other dysfunction or health issue, and you're taking medication, how does that affect your ability to sustain an erection, to even get an erection, and what can you do to help them?
Okay. To get an erection, what happens is your blood pressure from the artery, which is the high pressure side of your circulation, goes into the penis, and then what happens with an erection is the blood vessels get squeezed as they leave. The low pressure side closes off with the muscles. Okay, the muscles there close down when you get sexually excited. So that gives you an erection. That's what sustains the erection, is those muscles. Now, men and women both have decreases in testosterone as they age. That testosterone is what makes those muscles strong. Now, if those muscles become weak, you can't sustain an erection or even get an erection. If you're on blood pressure medicine, that lowers the high pressure side, so it makes it difficult. The beta blockers are the most common one for that. They'll lower your blood pressure, but not allow you to squeeze the low pressure side down enough to get an erection. There are new blood pressure medicines out called alpha and beta blockers that keep that from happening. Okay, so you can still maintain erectile sexual function. Now, if your testosterone's low, just like women, they have vulval vaginal atrophy. That's why the leakage occurs. Because those muscles are the similar muscles around the urethra in the female. So when you keep a normal hormone balance, those muscles stay strong when you cough and sneeze. You don't leak. A male will have those similar muscles around the venous part, the low pressure part, and they'll be able to longer maintain an erection with a normal testosterone level in their bloodstream. Okay, so it strengthens that for women and men both. Very similar. Any other questions?
Someone wanted me to ask you, if they come to see you, if you have something, do you do some kind of test to tell if their testosterone was low? And after you find out that it is low, what do you do? Can you treat them?
What you do is that there's a test we call it a men's hormone panel. You got to get a blood count because testosterone raises your blood count up. You need a PSA to make sure you don't have a risk for prostate cancer. Then you need a testosterone level, free and total testosterone, and an estrogen level. Okay? We're all built very similarly. You'll turn testosterone into estrogen. Some men have elevated estrogen and low testosterone. They just need a medicine to keep them from turning their estrogen or their testosterone into estrogen. That may work. Some people that work. Once we find that your estrogen and testosterone are out of balance, we can sort that balance out. Men need weekly injections. Some people give pellets. There's a medicine coming out now called AV, which is given once every 3 months. It's an intramuscular injection. And it'll bring your testosterone up to a normal level. Then you monitor that 1 month, 3 months, 6 months to make sure everything's going right and watch your PSA. As long as you've had a prostate exam in the last year and your PSA is normal, we can start treating you for that right off. Okay? And see if it works. It works pretty well. Some people are very sensitive to it, and they need higher doses than others. And as long as it's not affecting your blood count, your PSA, or your estrogen level, you can do that. You can take them up to levels that will be effective for you. Because different people need different amounts. Yes, sir?
What is your doctor's name? Urologist or what?
My name?
Doctor's name. Definition.
What is the definition?
What's his title?
Are you asking?
Specialty?
Yes.
I'm an OBGYN doctor,
Okay.
and I'm specializing in endocrinology.
Endocrinology.
Endocrinology is the study of hormones. And I focus on sexual hormones.
Endocrinology doctor.
I'm sorry? You have one?
Yes, sir.
You have diabetes or something like that?
No, I had cancer in 2006.
Thyroid.
Uh-huh.
Yeah. So they're maintaining that thyroid.
Yeah.
You know what's interesting about what you guys just exchanged is, I'm going to tell you, to give you a little background about Dr. T. I should have done this in the beginning, but how I encountered Dr. T is I was having stomach pains. Some of you may be familiar with this, have gone through this yourself. I was having stomach pains. I went to the ER, and they referred me to him, thank God. And in doing so, I had a partial hysterectomy. Now, when I had the hysterectomy, I didn't have a primary care physician, but even if I had a primary care physician, Dr. T handles it all. He does, my thyroid, I have a hypoactive thyroid. He controls my thyroid in his practice. He controls my blood pressure, my thyroid, all everything that's wrong with me, he takes care of it. So he does all of that. And I want to talk about a little bit about the emotional standpoint. Now, men, you have this as well. It's just, we know it. You guys just don't know it. At least you pretend like you don't know it. But women, we know. Yeah, we do. Yeah. So, you guys, you go through your whole thing too. But when we begin to go through menopause, our emotions change. My husband over there can attest to this. We are the most you can't get along with us. We don't even like ourselves. I'm gonna be really honest with you. We don't even like ourselves. So what happened, and I've always been the kind of person that even if I say something that hurts your feelings, I'm sorry, and I feel sorry for real. Well, during the time, and Dr. T can tell you this, after the hysterectomy, I think I was more awful than ever before. And Dr. T, his nurse, oh poor lady, I was just really, really awful to her. Dr. T had to come into the office, to the hospital the next day, and he says to me, Ari, this is my nurse. She's been my nurse for 25 years. I was like, oh, I'm still really, really not nice. And I said, oh, you like her? Okay, then, I'm sorry. I meant that, and I didn't care, because my hormones were all over the place. I really did not care. So he put me on, and there's several different ways you can be treated. Me personally, first, Dr. T put me on a pill. What is it called?
S-Trace.
S-Trace. And he was telling me about how this pill came from a female pregnant horse, right?
Oh, that's Premarin.
Premarin. He said this is a female pregnant horse. I was a little uncomfortable with that. I'm sure some of you are too. I took the pills though. But unfortunately the pills didn't work very well with me. So he gave me a compound. And the compound worked, but it was a little pricey. So then he changed me to a gel. So this is just to say that you have all kinds of options, because it doesn't stop. My mom, who's here, and I'm going to talk about her. My mom, she had menopausal problems and hot flashes and all those things for well over 10 years. So this thing doesn't just go away, right? So now I get the shot. It works for me very, very, very well. I wanted to talk a little bit about the emotional part, about how we are crabby and mean. And Dr. T even asked my husband, because he comes to my business with me, when we went right after my hysterectomy, he said, is she all right? Can you get along with her? Do you need some help? True? Honestly. He said, please. Okay? Please. So Dr. T, can you tell us a little bit about the emotional part?
Okay, I just wanted to tell you that I'm not Superman. I'm a primary care doctor, and I take care of simple problems. Thyroid cancer, I would never take care of. You need an endocrinologist for that. Someone specialized. Some endocrinologists don't know much about sexual function and the way sexual hormones work. So I kind of fill that role for people. And I'm a health advisor more than anything else. I try to keep you on track, to keep you well. As far as emotions go, yeah, you see big shifts in emotions. They shift as, everyone's experienced PMS. It's got, older, the estrogen drops off, the progesterone drops off, and all of a sudden you don't have enough serotonin. And man, alive, everything that runs through your head, you just say whatever comes to your mind. And you get mean, you have some mean thoughts going through your head all the time, but you don't say them.
Nice.
You think all kinds of things, but when you get a shift in serotonin downward because you're making sex hormones too busy or you don't have enough, man, it just comes right out of you. And it's just terrible on a relationship, it's terrible on your family members, and it's even bad for you because you get repercussions from saying things you probably shouldn't say. So that's kind of the approach I take for it. So we need to take the hormone levels up so you're not stealing it from the hormones that balance your emotions. Okay? You gotta balance it that way.
Well, he said he's not Superman, but Reggie's very happy. That's my husband. He's very, very happy. Now we're gonna do, we're gonna get into a question and answer segment. Generally we don't do that in the beginning of the show. Sometimes we do things differently, and that's fine. Kenny, I'm going to get with you. You'll be able to ask any question you like, because I appreciate the participation. What we're gonna do right now is we're gonna change the direction of the show a little bit. And we're going to do my favorite part, which is
door prizes.
door prizes. Now, as I said to you, and I say to you all the time, is I work really, 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 really hard to get these door prizes for you guys. So everybody have a ticket?
Yes.
Does everybody have a ticket? Please let me know if you do not have a ticket.
You need to pick a number when I take mine.
Everybody has a ticket, then I take it, right? All right, so Christy's coming with the other half. Thank you, Christy.
We're out of coffee, regular coffee.
We are.
There's a little bit of decaf left.
Oh, gosh. Okay. The number is 335. 335. All right. Come on up and pick your prize. This is not rigged. I do know mostly everybody here. She's my neighbor. That's why you like the number, right? You like green? Okay, so I want you to tell us what you got. These people are very, very kind to us, to sponsor, to give us door prizes, things that they can give to you, and we really appreciate it. So we want to acknowledge them. Sorry. McAllister's Deli. And they have lunch or dinner for two and their fabulous tea, absolutely free. Thank you, McAllister. And I want to tell you a story. I told this lady at McAllister, her name is Jessica. I told Jessica I was going to do a shout out to her. Jessica, thank you so much for your generosity. I want you to pick a number. The number is 325. 325. That's the last three numbers of the ticket. I'm going to give somebody a little time. What happened? You don't have a ticket?
I had it on a napkin and I threw it away.
Let's give him another ticket real quick. Can we give him another
So I
ticket
get
real
another
quick?
number.
He did tell me his number.
That's okay.
Oh, you know his number?
Yeah.
Okay, it's not 325.
It is.
It is 325. Come on up here and get your door prize.
Are you sure?
What you say? See?
Now, what did he promise her?
Yeah. Pick any one you want. Okay, let's see what you got. Improv. Anybody who doesn't know what improv is a comedy club that has a restaurant attached. And that's where all of the famous celebrities, comedians come to perform. And how much did they give you? $20. So he has a $20 certificate to go to the improv to watch the show, or to have drinks, or to have food. Can you pull a ticket for us, please?
Here you go.
Thank you. Thank you. And the next number is 333. Trio, yay! 333.
Everybody's with me. I can't wait. Oh, don't worry about it. You're going to get a chance. You can answer.
You can give it to me, that'll be fine. Thank you. Okay, you can pick anyone you want. Many of you have been here since the very beginning. Latrell's one of those people. Okay, Latrell, let's read that. That is Rudy's barbecue sauce. If you guys don't know Rudy's, most of you know Rudy's. Their briskets and their turkey. Thank you, Rudy's. Rudy's does a lot of donating for us, and we appreciate that. Thank you, Latrell. The ticket number 337. 337. I promise you guys, this is not rigged. Chrissy, you did just push them up real good, right? I know she did. Most of you guys know that's my mom. I had enough to do already. Oh, she likes this place. Buffalo Wild Wings, $10. She steals all my friends, so she and my neighbor, my former friend, will probably be going there. Okay, thank you guys, I appreciate it. Thank you everybody. Thank you for everybody who sponsored the door prizes. I really appreciate all of your generosity. Now, let's talk about sex. Right? Oh, she looks like she's very offended. Let me tell you guys, what we do here, I'm the person who's not afraid to say what everybody's thinking. I am going to do that. I don't have a problem with doing that, because the only way that we're free, liberation, is to be able to express ourselves. To be free in our thinking, to evolve into the people that we want to be. Because see, the problem is, and I'm not gonna preach, but the problem is that we have all of these things that we think and that we feel, but we're not allowed to say. Well, see, because it's 2015, God hasn't changed now, but what has changed is the outlook on life. And everybody knows that back in the day, we were not allowed to talk about sex, we were not allowed to say sex, and we definitely were not allowed to enjoy it. Truth of the matter is, we all do. Right? My mama here, and I'm still telling you guys this because it's true. Right? We all do. So let's talk about it. Let's talk about how our hormones affect our sex drive. Let's talk about the lubrication. Somebody talked about lubrication before. Let's talk about the emotional swings that we have that prevent us from wanting to engage, or that keeps us wanting to engage more than maybe our partner. So the floor is open up for questions, and I'll start because I've got a question. Dr. T, I know that I talk to a lot of women who want to have more sex, but their husbands don't have the desire, and then when they do, sometimes that they're unable to keep an erection. Can you talk to us a little bit about that?
Okay. Well, I think the first thing you need to know about sex is there are different ways that relationships work, okay? You can have closed-off sex, where one partner just wants to have sex, the other one doesn't, okay? That doesn't last very long. Relationships like that don't go on very well, okay? The other one is kind of just a way of having sex to please your partner. That doesn't work very well either. So what you want to have is a synchronization between the two of you, and that requires an emotional bond between the two of you. You need to be doing lots of touching, you need to do a lot of contact with your partner so that you can communicate your emotional feelings to them. That's good sex, okay? Good sex is more than a good orgasm, it's more than having multiple partners, it's more than anything like that. It's a bond between the two of you, and if you can get that synchronization going, that's good. Hormones play a role in this, mostly because they have an effect on the sexual act itself. If you don't have good estrogen for lubrication, the vaginal cells don't grow. On a pap smear, if you get a pap smear, you can see it says, oh, atrophy, basal cell, evidence there that there's estrogen loss. So the estrogen, you lose the estrogen and you don't lubricate during intercourse, and it makes it very uncomfortable. So that kind of pushes it away from the synchrony thing. You're not synchronizing very well. With males, testosterone has a lot to do with sustaining an erection and getting an erection. Libido is affected by testosterone in that it affects the thalamus, where you have fight, flight, sex, feeding, all that. The testosterone level required to stimulate a sexual response or a sexual interest is different for every person. So, Ari, when you're saying, that sometimes a partner doesn't want to have sex, it may be you're just kind of out of synchrony. Sometimes you need to move more toward your partner and push them a little bit in that direction. Give them some emotional support. Erectile dysfunction is a big thing. I mean, I see an advertisement every time I watch television at the gym. I see something about Cialis or something that has to do with sexual dysfunction for males. So it's a big problem, and a lot of it has to do with low testosterone and managing the sexual synchrony you have, because you fall into a pattern where you don't even want to talk about it anymore, or you're shy about it or something, and it takes a little busting out by both people in the relationship. So sometimes when there's no synchrony there, it's good to talk to both people at the same time, bring a couple in and talk to them at the same time and find out what the issues are, and see if you can't regenerate a synchrony between the two of them.
Right. That's really good. I got your question over here. That's the truth, because what happens, we're not saying that just randomly have sex. What we're saying is that in a relationship, sex is very important. And it's important that you have synchrony, that you relate to your partner. How does somebody know how to please you unless you're able to tell them that? And I think that's one of the reasons that before a lot of women didn't enjoy sex, and it was a run-of-the-mill type thing, because we weren't allowed, because we were taught not to do that. We were taught that we don't enjoy, that this is a man's pleasure, and we are to be submissive. I'm not saying don't be submissive, because the Bible tells us to do that. But I'm saying that sexually, you have the right to convey what you feel.
Yes. Good morning, Dr. T. My name is Kenneth Smith.
Thank you.
So let me first say, I believe I have the best wife in the world.
Great.
Some years ago, she passed out at her work because she was clotting. They had to take everything out. And she needs some help.
Okay.
Can you help her?
Come back and talk. Get your answer. His wife needs some help. Who is the best wife in the world?
How long ago was that?
Reggie. You know what I'm saying about him?
Oh, where are we? How long ago was that?
Huh?
How long ago was that?
Probably 10 years ago.
About 10 years ago? Did anybody offer her anything to help with her hormone balance at all? Or did they get surgery?
She's still working. You know, when we first got married, we were like rabbits. And,
You were synchronized.
so we still, we have cramps and all that stuff.
Yeah. Okay. Well, it depends on what her issues are and her balances, and everyone's a little bit different, okay? I like to think that we're the custom hormone people, because everybody's very different. And now I'm starting to see things being presented by the hormone manufacturers that say, oh yeah, you need to customize hormones. So it's not one pill for everybody. Different people have different issues. I guess the best way to explain it, and that's why I need to talk to people about it, is you've got the production of hormone, which you've lost, okay, when you had your surgery, you lost it. Then you have things like a sponge that hangs around in your bloodstream called sex hormone binding globulin. That attaches, it just sucks up the testosterone and estrogen and carries it around your body. If that's not full, which your body would normally know to do if you had ovaries, it just kind of hangs on to it. You don't get it. And And then the last part is the receptor sites. If you haven't seen estrogen at the tissues that actually give you pleasure during sex, you're going to need more estrogen than normal to get those satisfied, and then you back off down. So you kind of get things on track, satisfy those things, fill up the sex binding gland, that big old sponge, and then the tissues that really need it can get it, and then they start to quiet down a little bit.
Well, I went to a neurologist.
Yes.
And he told me to see if I could.
Go ahead, Kenny, we're listening.
Get an erection?
Yeah.
Yeah, what did he tell you to do?
He told me I can do it.
Okay,
And my wife, she can't do nothing.
okay. Well, let's see if we can't get that synchrony back. Okay, did he talk to you about what to do for your wife?
Uh-huh.
He did? What did he say?
He told me to, I can erection,
Uh-huh.
I can do,
You can get an erection.
Yes.
Okay. So if you get an erection, can you sustain an erection? Okay. So now we got to figure out how to get a normal relationship between the two of you when she's lost. See, it's a couples thing here. We got to do.
I'm 62.
Uh-huh.
I like to touch her all the time.
And the best way to touch is just to let it go. You're well synchronized, okay? You're just missing a little bit here. I think if we can get, if we can get something started for her, and we'll get off to see, since she's had a hysterectomy, it's very simple to give estrogen and testosterone, which will take care of the lower part of the vagina, the clitoris, the labia, and make sexual intercourse more pleasurable for her. And then the upper part will help with lubrication and elasticity of that. 10 years is a long time to go without having proper hormonal support.
Well, yeah, I mean, you
That's a
know,
long time.
I'll go to the doctor
If you're
in
healthy.
a New York minute, but she works and she don't have time to do it. She
Yeah.
needs to.
Right.
But let me first say, she's the first woman that satisfied my manhood.
Yes,
And so I'm completely satisfied when it comes to that.
yes,
So I have the patience to deal with her.
right.
But I know she needs some help because everything is gone.
Okay.
I run into that all the time because I have to do that to people with, rarely young age, 28 years old for endometriosis.
And she's
That's
54.
tough. It's tough to get them satisfied, and 54-year-olds are tough to get satisfied. But I hadn't run into anybody that I hadn't been able to help.
Wow. So Kenny, maybe your wife needs to see her. You're after this lady, then you, and then Miss Georgia back there. You got a question?
Oh, he asked.
He answered your question? Okay.
I had a whole idea of questions until you said the word endometriosis.
Yeah.
And I think that that's such a major thing. And my daughter had severe issues with it. Now she's already through menopause. And I'm very concerned about her 18, 20-year-old daughters. And I don't seem to think that the medical profession in general is addressing that issue with the young women before it can affect their childbearing capabilities. So I'm wondering if there's a method of determining in a woman who is young in her womanhood, but still may be a virgin, not yet her first relationship. And my granddaughter, for example, has severe menstrual cramps. All of the symptoms that I saw in my daughter all those years ago, before we knew it was endometriosis. And by the time my daughter married, late marriage, like 28, had to go 5 years before they realized the endo was causing her, making her incapable of becoming pregnant.
Right.
And so she had to go through all kinds of treatments and miraculously, I think, had 2 girls. But what can we do now about the young women who I don't think the doctors are looking at this situation that these young girls are going to be facing because the endo is attacking their organs. And do you know if anything is being done on that front?
I can just tell you what I do for the patients that I see that have chronic pain from bad periods. Some girls have terrible periods. endometriosis comes in different forms, several different forms. Sometimes you're born with the implants in the pelvic floor, and they respond the same way as the lining of the uterus. So, other people don't have that, but the endocervical canal is so narrow in some young girls that when they menstruate, they push the menstrual fluid out the fallopian tubes and implant endometrium into the pelvic floor, which destroys their fertility. So, a little girl with terrible periods, if she starts having terrible periods, I suppress her periods. I give her continuous oral contraceptive pills, and if she starts to spot, she gets a 3-day break, and then we quiet the entire endometrium down, all the way down. And then if she gets pain again, when she starts to cycle, when she decides to have babies, that will limit the spread of endometriosis, and sometimes it will die off. If the pain continues after that, you give a more powerful hormone called Lupron. Lupron will kill the endometriosis. It eliminates all the estrogen, even in her body's make. And that will kill endometriosis. But it can come back. It's a bad problem. It's a terrible problem. Unfortunately, we have means to get around it if we can't control it, other than surgery all the time, just to remove it. So controlling it in youth, and in youth is important. And what I do for people with bad menstrual cycles, we just suppress their menstrual periods. It's perfectly fine to do. That's how the pill was first designed, to stop your periods. Okay? So just do that and keep it as quiet as possible. When it comes time for reproduction, you might do a laparoscopy to make sure everything's okay. If the pain comes back immediately after you stop the pill, or it doesn't go away on the pill. Okay?
What if they're closet?
We have a question over here.
I was just wondering about the estrogen therapy itself. It can cause problems. And a lot of women don't want to take estrogen because of that.
Right.
So how do you determine who's going to take the estrogen? And do you have to go by prior cancer history or anything like that before you give these medications like that?
Absolutely. What you want to do, to know the, you have to know what the history of the patient is, right? Okay. And the information we've gotten from the Women's Health Initiative around 2000 showed that estrogen and progesterone increase risk for breast cancer by 5%. Now, have you heard from the NIH study in 2013 that the risk for breast cancer goes down with normal levels of testosterone from 390 per 100,000 women years to 73 per 100,000 women years? It cuts it fourfold. That's 400% decrease, not 5% increase. If you add testosterone to estrogen and progesterone to a woman who needs estrogen and progesterone, it lowers her risk for breast cancer. If you can get rid of the progesterone altogether, that lowers your risk for breast cancer. Okay?
It would be a lower level of testosterone, so they wouldn't end up with all hairy face and all.
No, they're not going to get, they're not going to be the bearded woman, and we're not going to put you in ripples, believe it or not. Testosterone levels are very, very low in women, but it's the most dominant hormone we've got. Okay? When that goes away, breast cell division starts occurring faster because testosterone suppresses breast cell division. Cancer is a mutation. Okay? Cancer is a mutation. When a cell divides, it has the opportunity to mutate. Testosterone keeps breast tissue from dividing. That's why the NIH is studying putting it in with other hormones. Okay? So that's a preventive, it's a protective effect for the breast. It may lower your risks. People who have blood clots have an issue with this, with oral hormones, okay? You can't take oral hormones. But patients who don't get it orally, if you get it either IM or a gel, they don't have an increased risk for clotting. So that takes that away, okay? So if you do take oral hormones, I don't know if anyone out here is doing that, make sure you take a baby aspirin with it. It will reduce the risk of the clotting. Okay, if you're on the oral hormones, you can reduced risk of clotting with the baby aspirin. And of all, really stop taking progesterone. Okay, if you can't avoid it altogether, just don't take the progesterone. The only 3 patients I've had in my practice in the last 8 years that got breast cancer were taking estrogen and progesterone pills, and they wouldn't stop. They had their uteruses there and they were balanced with the estrogen and progesterone, and they didn't want to do anything else. They were fixed, set in their ways, and they just didn't want to quit. Of the other 40, no one has ever taken hormones. And I've been giving estrogen, testosterone since 1990. We called it the hot flash buster because the testosterone backs up your estrogen, turns into estrogen as your body metabolizes it, and your hot flashes go away. So these young girls that needed an endometrial, needed to have the uterus removed from endometriosis, you couldn't get them to stop hot flashing. They were miserable. So we gave them an estrogen testosterone balance. And I've done that for a lot of people, not a single one of them has got breast cancer in 30 years. Okay? I look back when I heard this study come out, and I said, that's kind of interesting to see that, and not one of them has gotten it. Okay? So that's an encouraging thing for breast cancer risk reduction. The other thing is eating a good diet. Okay, we got to get to the wellness thing. Hormones and sex and all that are great, but you got to make sure you maintain a nice, healthy lifestyle so you can enjoy it for a long time. You got to get away from the sugar and starches. It's not bad to eat saturated fat. Butter's not bad for you. Those donuts are bad for you. Okay? The whole food triangle's been flipped over. You got to stay healthy. And I beg Ari to do what I tell her to do.
He does.
I'm not sure she does, but okay. All right. So anyway, it all blends together. Yes, ma'am.
When I went through menopause, I was having a lot of effects and things, the hot flashes and all that you were talking about. And my doctor put me on something, it's been so long ago, I don't remember what it was. It was probably an estrogen progesterone. And after maybe 5 years of doing that, I don't remember, I had breast cancer. And I quit taking those pills immediately. But that certainly didn't get rid of my cancer, and I had to have surgery and go through chemo and all of that stuff. So I wish I had known that information. And it is important.
Yes.
Thank you for sharing it.
Yes.
And maybe I can get my daughters to learn.
If we can prevent it, what I tell my patients, okay? Can everybody hear me?
I will give you the microphone.
Okay. What we want to do is, as far as breast cancers go, we want to keep away from progestin. That was an idea a long time ago. We gave progestin as a birth control method and experimented with beagle dogs. They all got breast tumors. So we stopped giving progesterone as a birth control method. Now we're back to doing it again. Okay? Now I'm not sure exactly why. Estrogen and progesterone, okay, will raise your risk for breast cancer 25%. If you drink 1 glass of wine a day, an ounce of alcohol a day raises it 25%. That never comes out in the news, does it?
No, it doesn't.
In an Italian study in early 1990, when we first started giving people folic acid to keep birth defects away, prenatal vitamins, okay? Birth defects just dropped off. So everybody in the world's taking, prenatal vitamins with folic acid in it. Italian women drink 2 glasses of wine a day on average. They don't care. Okay, they don't drink their wine. They have a 50% increase in breast cancer risk, but so what? They drink it anyway. The ones that continued their prenatal vitamins dropped to normal. So in the 90s, I started just telling everybody to keep taking the prenatal vitamins. Of course, they're $1 a day, so I said, just take the folic. I've been doing that since the 90s. Okay, I think it's a protective thing. Since then, Vanderbilt published a study that says vegan vegetarians have less breast cancer risk. British Journal published a study that says if you take folic acid, you have less breast cancer risk, especially if you drink alcohol. The first world countries have 10% more breast cancer than third world countries. Why? Because we don't eat as much vegetable matter. They have 10% less breast cancer in Honduras than we have in the United States. because they don't eat as high on the food chain as we do. They eat closer to vegetables. So I give all my patients a milligram of folate. It's off scale when I check the labs. And I like it that way. Okay? A milligram. You can get it over the counter. Yeah, get it over the counter. You take more, because the folic acid is inhibited by alcohol. That's probably what raises the risk for breast cancer that way. That's probably the most important factor. Okay?
What happened to my wife, that she was clotting real bad. I washed clothes.
Oh, for her uterus?
daughter, she clotted.
She's doing the same.
She's in college right now. She clotting right now.
She should probably get on a continuous contraceptive medicine. Yeah. Back to the cancer thing, okay? I think there are methods we can use to reduce risk for breast cancer. The other thing I want to talk to you about is surveillance. Mammograms miss 30% of breast cancer. They don't see 30%. That means out of about 1,000 women who have breast cancer, 300 of them don't even know they have it when they leave the mammography center. Mammograms are x-rays. X-rays are for bones. They're not for breast cancer. They miss a lot. And you go out of there thinking, I'm fine, and you're not. What you need to do is in the shower, you push down on your chest, on the breast tissue, and you slide, you feel the bumps. The right side should feel like the mirror image of the left side. Okay? If it doesn't, you go see your doctor, because there's an asymmetry there. If it feels the same, you're good. If you just had a mammogram and you feel the lump and it seems like it's getting bigger, they missed it, and you need to get it out of there. Your stage will go from stage 1, 100% survival when you first feel it. In a month, it'll be stage 2, which is 50% survival. In another month, it'll be stage 4, which is 25% survival. So you've got to find it, and the mammogram's not going to find that kind of tumor for you. Nor will an MRI or anything else. You've got to find that yourself. I've had 14 patients find their own. Only 2 weren't checking at stage 3 and 4 cancer. The other 12 found their own. 6 of them had negative mammograms when we repeated them. We told them to wait 6 months to get it again. They said, no, you biopsy it. We got the biopsy done, and they had the surgery to remove the stage 1. Okay? You got to find it yourself. Okay? You got to check yourself. And you just pass that around. Self-breast check is important. At the bottom of your mammogram, you'll see the disclaimer. Well, this doesn't really work if there's a palpable mass. And then it'll show you how to feel for it. Okay?
You know what I wanted to say? I have one question here, and I have one there, and then I have one there. Those breast check self-exams are very, very, very important. We can't stress that enough. Dr. T has stressed that really hard to me, that we have to check. It's not that hard. It's not that hard to do because, like he said, you're going to take a shower every day. So you can check every day to secure yourself. Like you just said, sweet. But I have a question about this, and I know all 4 of you. Do men get breast cancer?
Yes.
So how do men check?
See, they'll normally have a mass. Their breast cancers are usually a lot more aggressive because they already have testosterone, and if the mutation that they get is not suppressed by the testosterone, it's usually a very aggressive breast cancer. Wow. So they don't typically do very well. Okay? And it is a mutation. So what I tell my patients, don't press your luck, you press your breasts in the shower.
I like that. Everybody remember that. Don't press your luck, press your breasts in the shower. I got a question.
I just want to ask a man that never had an exam for prostate.
Yeah.
At what age do we usually go for prostate? And I have a son. My son went at the age he heard was 40, and the doctor told him that he could wait. I was wondering, is that true, or should he have been, or should he go?
Good question.
A prostate exam is probably the simplest exam in the world to do. Okay? It's within reach of the doctor. And having an exam at 40 is fine. It's perfectly fine. Why did he tell him not to do it? He was interested in having it.
He said he could wait.
Okay. Now, the PSA has got a lot of question. about it. You know, where you should treat it. You know, I have some male patients that have a PSA of 3 and it goes to 4 and it goes back to 3. Most people have one that's less than 1. Okay, as long as it's down there, you can you do that. But a prostate exam is a good exam. You don't want to do it before you get your PSA checked because it's going to elevate it. But it can be done anytime. I mean, if he's having problems or if he's just part of a normal physical exam is a prostate exam. Is the doctor not comfortable doing a prostate exam for him?
I don't know, but he just said that he can wait. I don't know.
You need to see another doctor.
Probably need to see another prostate-specific antigen. It's not like, the prostate's different than the ovary in that it's capsulated, and if something starts growing in there, you start to see proteins release into the bloodstream very early. Okay? So prostate-specific antigen means there's a nodule or something in the prostate growing, and you got to investigate it. If you just had an exam, you'll also see prostate-specific antigen out there too. But without the exam and you see it elevated, that means there's something in the prostate. So it's a good test to get, but people have been overreacting to it. You know, you get a 90-year-old man that has a PSA elevation, he's not going to die of prostate cancer. Okay, it's too slow. Everybody, your chances of prostate cancer increase with every decade of life. At 50 years old, it's 50%. At 40 years old, it's 40%. At 60 years old, 6%. I have prostate cancer. By the time you're 90, it's 90%. Everybody gets it. So it's just a matter, is it going to hurt you or not? And, you know, if you have it, sometimes it's best just to leave it alone and just watch. Watch. Wait for watching, okay? Because it makes a big change in life.
Thank you.
Is there a risk for strokes and heart attacks with taking estrogen?
Oral estrogen, yes, there is. There's an increased risk of stroke and heart attack because it can make your blood clot, because it goes through your liver in this process. Some people have increased risk for clotting, and I usually refer them to a hematologist to see if the risk is elevated enough to keep them from taking one. If you have a history of the clot, you probably should stay away from hormones because it's difficult to tell where the clot came from. The increased risk for stroke and heart attack is associated only with orally taken hormones that go through your liver, which makes those things that cause your blood to clot. So, or not clot. So if you're taking oral hormones, I always give baby aspirin with it because it balances the clotting system in a positive direction. Actually, you should be taking a baby aspirin anyway. 81 milligram aspirin is good to reduce your risk for strokes and heart attack. It used to be thought that estrogen prevented heart attack, but that never really panned out. It used to be thought that folate prevented heart attack, but that never really panned out. They each have their role, and the only thing that the American College suggests that is a problem with estrogen is orally administered estrogen raises your risk for stroke, blood clot.
What about the patch?
The patch should not. It should not raise your risk. Okay. Still, a baby aspirin is not a bad idea to take, but a subcutaneous or cutaneous dose that bypasses the liver is probably fine. It won't raise your risk. Okay. You won't eliminate it. You won't eliminate it, but it won't raise it. Okay.
Okay. Have one more question over here.
Well, mine was just that, since I don't take showers, the doctor told me to lay flat on a hard surface. My bed if it's firm or it's on the floor, and feel my breasts for the loss.
Did he tell you what to feel for?
His question was, did the doctor tell you what to feel for?
Oh, yeah, for the part.
Okay, one side against the other?
Yes.
Compare one side. Good. That's great. Now, if you don't take a shower, you take a bath,
Yeah.
you still soak up that part.
Okay.
Okay? So what you want to do with that part, if you get soapy, the way you find a tumor in soft tissue is you want to get rid of the friction on the surface of the skin. Because when you pull the skin, it doesn't let you feel deep inside.
It's an olive oil.
Olive oil is fine. Or you can just do it with soap. But you have to take the friction away from that. And that will, I'd help identify lumps like that. So whether it's showering or bathing or something like that, just make it convenient. Because if you're like me, if you do it once a month, you'll do it once a year, okay? Because I forget. You know, I forget. And since a high mitotic rate tumor is going to double every month, you don't want to forget that. So make it part of a routine thing in your life. I mean, you know, you couldn't hide a BB under your skin anywhere else. You can hide a golf ball in your breast and not know it until it changes the surface. And that's where most of these stage 3 and 4 cancers are coming from. People have a mammogram, they think they're fine, they lean over and they got dimpling on the breast, and they got a golf ball in there. Okay? I've had 2 patients over the last 8 years. One came in with a golf ball, had a negative mammogram in January, and a golf ball by August, which she leaned over and dimpled.
Wow.
The other one, 68 years old, 28 negative mammograms. Every June she knew she didn't have breast cancer. Okay? Thought she felt something in September, knew she felt something in October. November was Thanksgiving. She put it off until after Christmas, and she had an orange-sized tumor. She thought it was fibrocystic change. She came in because her bra didn't fit anymore. Didn't hurt, but I'm going to lose her. She's already had a recurrence. It's 2 years ago. Okay? Negative mammogram, 68 years old, 28 negative mammograms. Okay? She's going to die of breast cancer. So, you can't rely on the mammogram to pick up slow-growing, calcifying lesions. There's no other cancer in your body that's screened by an x-ray, with no other dye or anything else, except for breast. And we're stuck with that, I'm afraid.
Wow.
So, we got to do something around that.
We've got one more question, and I am very, very respectful of your time, and our time is first spent. I know Dr. T is a very busy man.
I really want to know the answer to this question here. One day I was watching television, and it was a serious talk show, and they were talking about sex. And what startled me was they said that you could get cancer from having sex. And I want to know, is that true? And also, I was reading a magazine one day, and I saw that same thing in a magazine. So is this true?
Wow. Sex can cause cancer. I better rethink my position. Yes, yes, yes. Yeah.
Well, if sex could cause cancer, I'd probably be dead by now. It depends. I enjoy it as much as the next person. Okay? And if you can see my wife, you'd see why.
Oh, yeah.
She's just beautiful.
Well, why did they put this on?
I have no idea. Other than the only cancer that could come from sex is HPV. Human papilloma virus is very ubiquitous. Everybody seems to be carrying it around themselves. And we've got inoculations, we've got things like we screen. That's what Pap smear screens for. It's human papilloma virus. It's a viral infection that causes the cells, the rapidly growing cells in the cervix, to mutate into cancer cells. It's a virus that changes the DNA of the cells that divide real fast. And so that's associated with cervical cancer, okay? Now, having an orgasm isn't going to give you cancer. Okay? There's good sex. Okay? You know, what is good sex? Good sex is getting together with a person that you really love and you connect with. That's good sex. Okay? That's not going to do anything but lower your, make you feel comfortable with life, make you feel well with life, make you feel healthy. It's a wonderful thing. It's not going to give you cancer.
Well, they should have said some more to that.
Well, not yet. It can give you an infectious disease that can lead to cancer. Okay? And then you don't want to get, you don't want to have multiple partners get HIV or, those things are, you got to be you have to be cautious. That's why it's important to have a single partner that you can couple with.
Yes.
There's multiple things, the self-serving kind of thing, or closed out sex where you just have sex to satisfy yourself.
Right.
That's not going to create a relationship. Solace sex, where you have sex with your partner just to keep them happy, that's not going to keep a relationship going. You got to come together for that. And I've never seen that hurt anybody, and I've got some patients who've been doing it for 30 plus years, maybe more. I've never seen him get cancer from it.
I know y'all time is important. What insurances do you take? MetLife, Humana, what?
I wish I didn't have to take any of them, but you can call the office, you can call the office and get the number, who's ever there, and I don't require you to have insurance, and our fees aren't that high. So if I don't take it, I can see you anyway, and I don't, rate my patients with fees, okay? And if you have, a lot of people have high deductibles too. So just because you have insurance doesn't mean they're going to cover what you get taken care of. And they don't care whether you have sex or not. They'd rather you didn't. They don't care whether you have hot flashes. And the pharmaceutical companies are going crazy with their prices. The hormones now, patches and gels and stuff like that, get to be $100 a month. So we get compounds together, and the least expensive one we can do is $25 a month with estrogen and testosterone. And a lot of people do that. And it keeps them balanced, and it's not breaking the bank. Because now Medicare doesn't pay for any kind of hormones, practically. And that's just not fair. I said, well, okay, you hit 65, you got to have Medicare, and they're not going to pay for your hormones. And then the prices go up because everybody's sharing costs with everything else. You can pay $100 a month for a gel or whatever. So that's an issue too, is just the cost of all this. And how the insurance is working out, the deductibles and things like that are just driving people crazy. And it's getting worse, really, not better.
Thank you, Dr. T. Thank you so very much for joining us today. I certainly hope that everybody has taken something away with them today. The reason we do this is so that we are healthier us. Dr. T is awesome doctor, I guess everybody would agree with me. He does know his patients personally. He takes the time to get to know who you are. Kenny, you probably should see him afterwards. Because he's really good. And like he said, in terms of your insurance, he will see you. He will make some kind of arrangements with you. So please, if you need his help, you need some assistance, if you just have some questions, please don't hesitate to call his office. I'm only going to bring you people with integrity, with quality, and who care about you. Now, Dr. T has brought some things with him. He probably can tell you a little bit more about them. What you brought.
Oh, sure. I hand a folder out to my patients. Inside this folder, we've got just some suggestions. There's a great thing to do for your weight control, metabolism. There's one on saturated fat and how we need to change our diets. There's one on using some metformin. Probably a lot of you know about metformin and how to use it to help your weight control. There's one on intermittent fasting and how you can cause growth hormone to release from your body naturally, so it keeps your muscles and bones healthy. So I thought those three would be important for you to see. Okay?
Okay.
Yeah, sure, I brought some of those. I brought the pen, though.
So there's sparingly. I probably can I get more from you?
Yeah, sure.
Okay, so if you guys need more, I can get them from him. I hope, are all mics clear? Yeah. Great. I just want to say one other thing. When you leave today, I want you to remember something, because it's important that you know this every day of your life, that there is life after 50. I'll see you guys.